Hello, everyone. This is Ask Endocrinologist. I'm Dr. Grace, and with me is Dr. Hope.
Hi, I'm Dr. Hope. Welcome. Thank you so much for joining us again today.
Yes, so we're back again, and for some of you who are joining us for the first time, this is Ask Endocrinology channel. This is where we talk about our health and how to stay healthy. And if you want to know more about how to stay healthy, or especially regarding to your hormones, you are in the right place. And for those who have been with us for quite a while, we want to say welcome back. Today, we want to talk about how to lose weight in a healthy way and how not to gain the weight back. Because some of us have tried to lose this weight, but we're gaining it back. Or maybe you have just lost the weight and you want to see how you can maintain this weight. So you are in the right place, and we're going to talk about it today.
All right. So we're going to start out with talking about diet. Diet. If you want to lose weight, diet is the number one way. So, one, be intentional about what you're going to eat. Plan your meals. So, be intentional. That means if you want to lose weight, then, plan what you would eat for breakfast, lunch, or dinner. Make sure they include foods that are low in sugar and low in carbohydrates and fat. Um, Choosing healthy meals, so meals that are comprised mostly of vegetables and fruit and smaller amounts of carbs, and also including some lean protein in the diet. And portion control is the key. So smaller portions is very important. Also, drinking more water and less carbonated drinks, less sodas, and less high sugar juices. So, just drinking the water helps keep you healthy and will also help with your weight loss journey.
Yeah. Absolutely, absolutely. I totally agree with that, Dr. Hope, that losing weight can be, it can sound very easy, but most of the time it's all these basic little things that really count, So let's make those things count. And like I said, there is a small, like this size of cup that I have here. You can use it actually as, for instance, your size of meal. Like, okay, per meal, I don't want my food to pass the size of food. So it makes you subconsciously not to waste food, and at the same time prepares your mind that whatever is in this cup is what you will eat. And this helps you as a small to take a small portion meal.
Right. So even choosing smaller plates or smaller bowls
Yes.
will help you just be more conscious about the amount of food that you're putting on your plate or in your bowl, or whatever you used to eat, just making sure it's less than what it was before. So that
Yeah.
will help with your weight loss journey. And then
Yeah.
we also want to talk about the intermittent fasting, right, Dr.
Yes,
Grace?
absolutely. Yeah. So intermittent fasting, it's a very good thing to do. First, it helps to lose weight in a very healthy way. And they said you eat around like 8 hours, you fast for like 12 hours, So it depends on where you are in your time schedule. Some like Dr. Hope, I think you were saying that you do 12 to 8 only, you eat between
Right, that's right.
noon and you
Yeah,
eat, and then you don't eat until after 8 p.m. So
right.
for someone like me, I practice it as well, and I love it. I'm enjoying the intermittent fasting. I don't have a fixed time until when not to eat. I just keep myself fasting till when I'm hungry. And sometimes I'm not hungry until like 2 p.m. and then I eat till like 9 p.m. and that's it for the day. And
That's
even in between those hours, I'm not eating the whole food in this world. But it is allowed that you can eat as much as you can because that's the active period that you are. You can walk around, eat, and enjoy yourself. But I still keep myself in a small portion meal, even at that period.
that's
So, small portion meal is a very good key to
yeah.
lose weight. And
Ab-
also, it helps boost your immune system. Studies have shown that it helps boost your immune system when you are going through intermittent fasting. Yeah.
That's right. So even when you're sleeping, so it's actually 8 hours of eating and 16 hours of not eating. So even,
Yes.
including your sleep time. So
Yeah.
so that you are able to just put that eating time in a small amount of time during your day, your
Yeah,
24-hour day.
you're absolutely right. It's 16 hours, 8 and 16, not 8 and 12. 8 and 16. Yeah, so yeah, aside that, then we do exercise, have it in mind to do exercise. Exercise is very important. We cannot but continue to talk about it. Ideally, you should do 30 minutes per day for 5 days a week to maintain your weight. But to lose weight, you want to do more of cardio, you want to do more of exercise, aerobic to go further. Don't overstress yourself on the weight, on the exercise, because they say what you eat is what you are. So you have to be more careful of what you are putting into your body and maintain it in the gym. So that's my own philosophy.
That's right. And for the exercise, you should do moderate intensity or even high intensity if you want to. But
Yeah,
walking is a great exercise that most people can do. So definitely including swift or brisk walking in your exercise plan is a
mhm,
great way to maintain your exercise regimen. And if you do more than 30 minutes 5 days a week, then that would help you lose the weight. 30 minutes, 5 days a week, as Dr. Grace said, it definitely is the minimum recommended for a healthy exercise lifestyle.
yeah, absolutely. So, aside from this exercise and the weight loss and diet, some might have even tried all this and they feel like, what, doc, this is not me. I have tried all these things you have mentioned. I've even taken all those drink and tea that they talk about. I'm not losing this weight. It can happen. Okay. And that is why we are endocrinologists, to let you know there are hormones in your body. There are medical conditions that can actually make you not lose the weight, no matter how you try. And some have genetic condition, and some have truly correctable medical conditions that can be treated. And once it's treated, you get you lose the weight easily.
Right. And some of those conditions are hypothyroidism and Cushing's disease. So those are some endocrine causes of weight gain, but there are other causes of weight gain as well, like heart conditions and kidney failure can cause you to gain water weight. So definitely you would need to check with your doctor so that you can be evaluated for causes of weight gain, especially rapid weight gain,
Yeah,
to make sure there's no medical reasons for your weight gain. And then lastly, we wanted to talk about medications. So if all else, if the diet and exercise is not helping you to lose weight, you can get an additional boost with some of the medications. And we know of the very common GLP-1 medications that are out there are
yeah,
helping a lot of people lose weight. There's some that are specific for patients with diabetes, and there's some for patients without diabetes. But definitely medications like those Trulicity, Ozempic, Mounjaro for those with diabetes, and they have the Wegovy, Zepbound, and other medications for those without diabetes that would help you lose weight as well.
yeah. And these medications are very promising because we've seen many people, many of our patients losing weight, and they are losing it correctly, like rightly. And There are new medications out there. Most of them are new. Studies are still ongoing as to what side effect and not what side effect, but so far they've been good.
Yeah.
So it's something worth trying. Ask your doctor if you meet the criteria or if you really qualified to get this medication, and that this will really help you in losing the weight. Okay, so how do you not gain this weight back? When you have tried everything, you even taken the Ozempic that Dr. Hope have mentioned, and you feel like, oh my goodness, I'm gaining back my weight. The moment I stop for 1 week, it's like all my weight are coming back. Are there things I can do to not gain this weight back?
That's right. One of the things are just maintain that diet. A lot of times when we on a diet to lose weight, and then when we lose the weight, we go back to the previous diet, which caused us to gain weight in the first place. So try to maintain a healthy diet. So make it a lifestyle change, not just for a short period of time. So definitely diet and just having accountability and maintaining that exercise. So exercise is very important in helping with weight loss maintenance. So continue to have a consistent exercise regimen and an accountability partner, having people that exercise with you or helping people that diet with you. That I talked about one of my colleagues that we do the intermittent fast together, and we both start at 12 o'clock. So 12 o'clock, we're like, okay, this is time for us to start eating now. So it really helps to have an accountability partner, whether a family member, friend, colleague. It helps maintain the weight loss.
Yeah,
So yeah,
that's
that
awesome.
works.
Yeah, so let us have it in mind that we cannot, but and keep trying to lose this weight. Okay, don't say you have tried and you're giving up on yourself. Do not. Okay, do not give up on yourself. Keep trying. Okay, keep seeking for help, and before you know it, you are healthy. You are staying there. I know why we're laying emphasis on all this, because too much of weight gain on your body can predispose you or push you into some medical risk conditions that you don't want to have. So it is good for you to control your weight, lose the weight, maintain the weight, avoid gaining the weight back, and seek resources out there. And remember, the more you know, the
The
better.
better you are.
So thank you for watching us today. Until next time. Bye.
Great. Have a great day.